sorry, I apologize. I am not. I was certainly open if there were scientific data sets or evidence associated with anything that would help keep our children safe. I was open to seeing it. I have not seen that data.
Dr. Hari?
Ditto. We've asked for the data and asked for the modeling to support any decision that is done.
Are either of you aware of any scientific evidence to support changing eligibility for COVID vaccinations?
I have not seen any evidence.
No.
I think it's pretty alarming that if there was such data, the CDC director and the medical officer would absolutely be aware of it, and apparently there is none. I want to continue asking about the ACIP. Dr. Menares, you mentioned that Secretary Kennedy asked you to pre-approve the September ACIP vaccinations a month before the committee was scheduled to meet without knowing what they were or what evidence that was based on, correct?
Correct.
I find that troubling and ironic, given what Secretary Kennedy said in June when he fired all 17 members of the ACIP without cause and called them, quote, a little more than a rubber stamp. That's exactly what he wanted you to be for the new board, for his new board of unqualified vaccine skeptines. The former members of ACIP actually met in April. Dr. Menares and Dr. Hari, would you feel confident telling parents they could trust the recommendations of the advisory committee that were made back in April? Before they were fired.
Yeah, I would say that the individuals that were participating in April had the commensurate skill sets and background to be able to evaluate the decisions before them. The processes were regular in terms of using the evidence to recommend. There was working groups that substantiated the information. There was robust deliberation during the ACIP meeting. I would say that it comported to the standards where the Americans could trust them.
Dr. Harris?
Agree. The data was presented and the committee was filled with experts with experience.
The newly chosen ACIP members met in June and they're going to meet again tomorrow. Will you, either of you, feel confident telling parents they can now trust the ACIP recommendations that come out of this week's meeting?
I'm very nervous about it. I don't know. They haven't met yet. I know that the medical community has raised concerns about whether or not, again, they have the commensurate backgrounds to be able to understand the data and the evidence and to evaluate it appropriately. I haven't prejudged. I don't know what will happen, but I certainly will be watching.
Dr. Hari?
I have significant concerns as the public hasn't been able to weigh in. The general vote should have been posted 2 weeks ago so the public knew what was being discussed other than high-level things. There haven't been work groups other than for COVID, and there haven't been, as of yesterday, the data hadn't been posted yet. So it's unclear to me what decisions are being made.
Thank you. Thank you very much, Mr. Chairman.
Senator Collins.
Thank you, Mr. Chairman. Dr. Menares, the recent turmoil at the CDC only serves to further undermine public confidence in its recommendations. You've had a very unusual tenure there, to say the least. You started out as acting director and had a good relationship with Secretary Kennedy, such that he recommended your appointment to the president. Then you were confirmed by a unanimous Republican vote, but opposed by every Democrat and every independent in the Senate. Then, less than a month on the job, you were abruptly fired. So I want to discuss with you further the grounds for your firing, even though I recognize the president has that authority. But as many of us have said, we just changed the law to make the CDC director appointed or confirmed by the Senate. And thus we have a duty here. First of all, Secretary Kennedy replaced every single member of the advisory committee. Did he consult with you about any of the replacements?
No.
When you met with him on August 25th, you have testified that he asked you to approve the recommendations of the new members of the committee, regardless of what they were. Is that correct?
That is correct.
So Secretary Kennedy, in testimony before the Finance Committee, has denied asking you to do that. Is there any doubt? Could you describe the discussion that you had on that issue?
Yeah, I'm happy to. The secretary in that morning meeting was very upset, very animated, and he said, with regard to that particular topic, I have heard that you may not sign off on the forthcoming ACIP recommendations. And I said, I cannot sign off on something before I see the data and the evidence. And he said, and elaborated on this for some period of time, that there is no data and evidence, there is no science, that CDC has never collected the data, the evidence, and the science associated with the safety and efficacy of the vaccines, and that I needed to commit to signing off on each and every one of those recommendations. And if I could not commit to that, I needed to resign.
What are the implications for public health if important scientific decisions at the CDC are made by the political staff rather than the career scientists?
It concerns me. It really concerns me. As you are aware, and Dr. Oury can elaborate on, these are very important, highly technical discussions that have life-saving implications for our children and others who need vaccines. And if you don't have the commensurate skill sets or the ability to ask the right questions, and you're willing to sign off on decisions that are not made with the best available data and evidence, it does put at risk our children. It puts at risk others who need these vaccines, and it takes us into a very dangerous place in public health.
Dr. Oury, did HHS's response to the measles outbreak earlier this year differ from its response to other infectious disease outbreaks in your previous interactions with the department?
Yes, in several ways. First, I never briefed the secretary, as did the center director who oversaw measles never briefed the secretary. In an outbreak response, usually you would be briefing leadership. The second thing is he said things like vaccines had fetal parts, and I had to send a note to our leadership team to correct that misinformation. We were also asked to include things like budesonide and clarithromycin in our toolkits for physicians, and I couldn't allow that as there wasn't evidence for that and would result in harm.
Thank you.
Thank you, Mr. Chairman. Dr. Menares and Dr. Oury, thank you for being here today and being willing to provide this committee with information about what is happening at the Centers for Disease Control and Prevention under Secretary Robert F. Kennedy Jr.'s leadership. Despite his proclamations of radical transparency, Secretary Kennedy has consistently failed to provide information to Congress as he continues to undermine public health from his role in the Trump administration. You've heard from me before, having Secretary Kennedy in charge of the health of Americans is dangerous. And what we're hearing from you today really underscores this for me. Dr. Menares, when your confirmation was before the Senate, I had my doubts that anyone in your position would be able to stick to the science and stand up to Secretary Kennedy as he compromises the health of the country in order to further his own ideas and agenda. I am pleased to see that you and other senior members of the CDC, like Dr. Oury, did stand up to him when the time came. You've both spoken about censorship and requests to compromise scientific integrity. Dr. Menares, did Secretary Kennedy ever give you instructions on how you should interact with members of Congress?
He did. After the morning meeting, I became very concerned. I was alarmed that I was not being consistent. I would not be consistent with those areas that I had committed to this committee that I would do: transparency, integrity. And I had reached out to the committee to share my concerns. Secretary Kennedy became aware of that, and he was very concerned that I had spoken to members of Congress, and he told me I was never to do it again.
Congress and the American people need to know what is happening at the CDC. And this censorship is not radical transparency, and it is unacceptable. Dr. Ari, I was shocked to learn that you found out about the changes to the COVID vaccine policy on the social media platform X. Decisions like this must be made in consultation with CDC experts, because otherwise we are left wondering who is advising the Secretary of Health, or if his own conspiracy theories are enough to dictate who can get a vaccine. Dr. Ari, did you ever brief Secretary Kennedy?
I never briefed him. I accompanied him on a tour of CDC after the shooting.
Did your center directors ever directly brief Secretary Kennedy?
They did not.
You were the chief medical officer at the CDC. Would you say that it's harmful to the public if the secretary is not informed by experts like yourself?
Very much so.
How would you characterize Secretary Kennedy's approach to working with scientific experts at the CDC?
You know, we would have loved to have had the conversations with him. I offered to 2 different HHS leaders that we would like to brief the secretary. He never received that, and many times I would send emails to our leadership team to share with HHS when he did say things that weren't scientifically correct so that we could help support him. But again, our requests were not received to brief him.
So tomorrow, ACIP is set to discuss childhood vaccines. And based on what we've seen happening under Secretary Kennedy's leadership, we have to expect it will produce weaker recommendations for these vaccines. And at the same time, there is no Senate-confirmed CDC director in place. Secretary Kennedy has installed someone he is convinced will rubber stamp whatever decisions his anti-vaccine advisory members make as the acting director. In Wisconsin, there are currently 36 cases of measles, all in unvaccinated individuals, 22 of whom are children. I am thankful that we have not seen any deaths yet, as we have in Texas. Dr. Ari, you have seen firsthand in the ER what vaccine-preventable disease can do. What would an increase in vaccine-preventable diseases mean for children and families across the country?
It's going to be heartbreaking. Not only will it overwhelm our healthcare system, but children will have, some of them will be deaf. You know, we've seen congenital measles cases in the U.S., and I think what concerns me is these aren't harmless diseases. We just saw the case in California of a young child that died of encephalitis from years after measles. These diseases have long-term consequences, and we don't need, in the U.S., we have gone so far in reversing this. We don't want our children to die.
We'll go next to Dr. Marshall, and then for the sake of the committee, after that, we'll take a 15-minute break to go vote, and then we will come back and continue. Dr. Marshall.
Dr. Menares, despite the president's executive order, did you encourage people to work remotely ever?
I did not encourage people to work remotely.
Okay. There were allegations that you took some of the political appointees and you basically took them out of your orbit, out of your office area. Did you reassign office location, desk location for the political appointees?
So I do want to go back to your first question. After the shooting, I allowed staff to work remotely.
Okay, you can give us the details of that later. The second question, did you push political appointees out of your main office area, reassign the political appointees seating?
I brought some political appointees in. I had,
My question is, did you move some out?
so there's a limited number of offices in my
Did you, I guess a yes or no, did you move political appointees out of your main orbit?
and I brought other political appointees in.
Okay, you can give us the details of that later. Do you believe every child over the age of 6 months should have a COVID vaccine at least annually?
I believe that is a discussion that a parent needs to have with their pediatrician. And if it is right for that child, based on the risk, then that child should have the opportunity to get the vaccine.
If there's reports come out that show that indeed the COVID vaccination led to the death of children, would that influence your advice?
Certainly would want to know about that.
Okay, the CDC currently recommends between 70 and 80 shots over the child's lifetime. Do you fully support that recommendation that every child needs every vaccine as recommended by the CDC?
The data associated with those recommendations has been validated and vetted. That is the current schedule.
So you agree that you support every child needs every vaccine that's on the CDC recommendations, all 70 to 80 jabs?
The childhood vaccine schedule has been vetted and validated through science and evidence. The almost 20 different diseases that are mitigated through those vaccines are very important. I think that every parent should have the opportunity to talk to their pediatrician and make sure that they understand the benefits and the risks of those vaccines and what is in the best interest of their children.
Do you believe any or all of those should be mandated?
CDC does not mandate vaccines. What CDC does is provide the evidence associated with the recommendations so that a parent and a physician can make the best determination for them.
When you were considering this job as CDC director, was there ever any doubt in your mind that you could fulfill the mission to work with Secretary Kennedy?
There wasn't. I have worked for political appointees and politicians for almost 20 years. And my experience has been when it comes to critical and important issues like science and medicine, data has always been paramount, and it has always been the core driver to how we work together.
Would you agree with me, though, at this point in time, that you're not the right person for this job, that your belief system, thinking that every child needs every vaccine, which is what your CDC does, every child needs every vaccine, all 70 to 80 of them, is certainly a different mindset than Secretary Kennedy's. And that if the university president, I think a great sports analogy, I hate to do this, but the university president and the athletic director decide you're not the right coach for this team, then it's probably time to say goodbye and we need a new coach. Would you agree that certainly you're going in a different direction philosophically than Secretary Kennedy is?
So I will stand behind scientific integrity with every decision I ever make. If I am put in a position of having to say, I will cede scientific integrity to retain my job, then I am not the right person for the position. I believe that we must have science and evidence to support the best decisions for our children and others who would benefit from vaccines.
So I think here's the biggest difference in philosophy that I see, is that I think the CDC is the cause of vaccine hesitancy, that you are the problem, that because of COVID and you're forcing these vaccines on people that weren't ever really proven or justified, that the benefits didn't outweigh the risk, and you all sat there with your hands in your pockets and you let that happen. And then you let this hepatitis vaccine be at 1 day of age, be forced upon everybody. And all of a sudden, the moms and the grandmas never trust you because you're trying to force a vaccine that's not necessary at day one. If you're going into nursing school, medical school, absolutely, you should consider that hepatitis vaccine. But basically what the CDC does is act like a mandate. And you force doctors that don't agree with you to kick patients out of their clinics because they don't want their child to be exposed to a vaccine that was approved after just like 140 patients took it, being followed up for 5 days. It just makes no sense to me that every person needs every vaccine. But regardless, some of the vaccines have done incredible work. They are a miracle. They've done a great job. The basic vaccines that we got in the 60s and 70s, polio, MMR, DTaP, those seem to be great vaccines that have told the test of time. But your attitude here that every person needs every vaccine is completely contrary to Secretary Kennedy's philosophy and the mission of the president. Thank you.
So, as announced earlier, we will stand in recess subject to the calling of the chair. I expect it'll be about 15 minutes. We ask the members of the audience to stay in your seats so the witnesses can retreat to the holding room. We'll be back.